12 weird signs that show you're having diabetes. Welcome to our deep dive into the often misunderstood world of diabetes. Today, we're not just talking about the common signs, we're uncovering 12 weird, less-known symptoms that could be silently indicating diabetes. This isn't just about knowledge, it's about prevention. With diabetes affecting millions worldwide, understanding these subtle signs could be your best defense. These symptoms are easy to miss but critical to catch early, as they could mean the difference between stopping the disease in its tracks and long-term complications. So, let's unveil these hidden indicators and arm ourselves with the power to protect our health. Most people associate diabetes with certain lifestyle choices, but the truth is more complex. It's not just about sugar intake, there are numerous, lesser-known factors that can contribute to the onset of diabetes. These include processed foods, imbalanced diets, and even environmental factors. Today, we're going deeper than the common knowledge, exploring 12 unusual signs that you might be missing. And it's not just about identifying these signs, we'll also delve into practical steps you can take to manage or even prevent diabetes. Remember, this video is for educational purposes, so do consult with your healthcare provider for personalized advice. 1. Changes in skin texture. Kicking off our list is a sign you might never link to diabetes: changes in skin texture, especially around the neck. It's more than just a skin issue. In diabetes, particularly type 2, high insulin levels in the bloodstream can cause skin cells to regenerate atypically, leading to thicker skin and dark patches. This isn't just a cosmetic concern, it's a subtle hint from your body that something's off with your blood sugar levels. Recognizing this early could be key in managing diabetes more effectively. 2. Constant itching. Next on our list is a symptom that's easy to brush off: constant itching. It's not just a matter of dry skin, it could be a diabetes alert. High blood sugar levels can lead to nerve damage, which often manifests as persistent itching. This symptom is particularly noticeable in areas like the lower legs. If you find yourself constantly itching without a clear cause, it might be time to look deeper, as it could be your body signaling blood sugar imbalances. 3. Ache in limbs. Moving to our third sign, it's something you might attribute to fatigue or strain but could be more serious: a constant ache in your limbs. This discomfort is often a sign of diabetic neuropathy, a condition where nerve damage occurs due to unmanaged diabetes. Patients frequently report a dull, persistent ache, sometimes accompanied by tingling sensations. If you're experiencing such symptoms regularly, it might not just be wear and tear, it could be an indication of underlying blood sugar issues. 4. Paresthesia. Paresthesia, our fourth sign, is an unusual but significant indicator of potential diabetes. It manifests as odd sensations like tingling, numbness, or even a prickling feeling, primarily in the extremities such as hands and feet. This isn't a symptom to ignore or brush off as just a transient discomfort. It's a clear warning from your body about nerve damage, often a direct consequence of elevated glucose levels. Persistent paresthesia, especially when coupled with other symptoms, should prompt a deeper look into your health, as it might be signaling uncontrolled diabetes. Don't overlook these sensations. They could be key signs your body is struggling to regulate blood sugar levels. We've just explored 4 unusual signs of diabetes, from changes in skin texture to the often ignored paresthesia. These signs are not your everyday aches and itches. Coming up, we're diving into more hidden symptoms that your body might be using to signal diabetes. Stay with us as we uncover more surprising signs, including some you might never have linked to blood sugar issues. Understanding these could be vital in managing or preventing diabetes. Let's keep decoding these hidden messages from your body. 5. Fruity smelling breath. The fifth sign is both peculiar and often overlooked. Fruity smelling breath. Known medically as diabetic ketoacidosis, this occurs when the body starts breaking down fats instead of sugar, leading to the formation of ketones. This process gives your breath a distinct, sweet, or nail polish-like odor. It's not just an unusual quirk, it's a serious warning sign, especially if coupled with other symptoms. Fruity smelling breath is a red flag, indicating that your body is struggling with high blood sugar levels and warrants immediate medical attention. 6. Infertility and sexual dysfunction. Our sixth sign, infertility and sexual dysfunction, is a critical yet often disregarded indicator of diabetes. In men, particularly with type 2 diabetes, this can manifest as erectile dysfunction, stemming from damaged nerves and blood vessels due to high blood sugar levels. Women may experience decreased libido and lubrication issues, although research in this area is less extensive. These symptoms are not just personal concerns, they're significant health indicators. If you or someone you know is experiencing these issues, it could be more than just an isolated problem. It could be a sign of underlying diabetes affecting the body's systems. 7. Lightheadedness. Sign number 7 is lightheadedness, a symptom often mistaken for mere fatigue or hunger. In the context of diabetes, it's a sign worth paying attention to. High blood sugar can lead to frequent urination, which in turn can cause dehydration, a common trigger for feeling lightheaded. This isn't just a passing spell of dizziness, it's a bodily signal that your hydration and blood sugar might not be in balance. Additionally, dehydration can affect brain function, impacting concentration and memory. If you're experiencing persistent lightheadedness, it's crucial to consider your blood sugar levels as a possible underlying cause. 8. Weight changes. The eighth sign to look out for is unexpected weight changes. In diabetes, weight fluctuations can be puzzling. In type 1 diabetes, the lack of insulin causes the body to use fat and muscle for energy, leading to weight loss. Conversely, in type 2 diabetes, the body's inability to use insulin properly often leads to increased hunger and potential weight gain. This sign is a deceptive indicator, as weight changes can be attributed to various factors. However, when coupled with other symptoms on this list, it's a significant clue pointing towards diabetes. We've just navigated through 8 intriguing signs of diabetes, including the often misunderstood weight changes. But there's more to this story. Up next, we'll delve into additional signs that are easily overlooked, yet crucial in understanding diabetes. From digestive changes to the subtleties of our emotions, these signs paint a fuller picture of how diabetes can quietly affect our lives. Stay tuned, as we unravel more hidden clues your body might be sending about your blood sugar levels. 9. Constipation. Coming in at number 9 is a sign that's often ignored: constipation. In diabetes, high blood sugar levels can damage nerves in the intestine, leading to a slowdown in digestive motility. This change might seem sudden, especially if you've had regular bowel movements your whole life. While there are many possible causes for constipation, when it occurs alongside other signs on this list, it should be considered a potential red flag for diabetes. It's a subtle but significant symptom, indicating that diabetes might be impacting more than just your blood sugar levels. 10. Irritability and mood swings. The 10th sign is something that affects not just the body but also the mind: irritability and mood swings. While often attributed to stress or fatigue, in the context of diabetes, they can be a result of fluctuating blood sugar levels. Unmanaged diabetes can lead to rapid shifts in mood, causing episodes of unexplained irritability or emotional changes. Recognizing these as more than just behavioral traits, especially when they occur alongside other diabetes symptoms, can be crucial in identifying underlying blood sugar issues. 11. Long daytime naps. Our 11th sign takes us into the realm of sleep: long daytime naps. Surprisingly, this can be more than just a sign of tiredness, it's potentially a marker of diabetes. Studies suggest that individuals who frequently take extended daytime naps may have a higher risk of developing type 2 diabetes. This symptom isn't just about catching up on lost sleep, it could indicate that your body's energy regulation is off balance due to blood sugar issues. If you're experiencing an unusual need for longer naps, it's worth considering your overall health, particularly your blood sugar levels. 12. Poor healing. Wrapping up our list at number 12 is poor healing. If you notice that cuts or wounds are taking longer than usual to heal, it could be a sign of diabetes. Elevated blood sugar levels can impair your body's natural healing process and weaken the immune system, leading to slower recovery from injuries. This symptom is particularly concerning because it not only signals potential diabetes but also increases the risk of infections. If you're experiencing delayed healing, it's crucial to consider your blood sugar levels as a possible factor. Reversing diabetes. Fortunately, managing diabetes effectively can lead to significant health improvements. This management often starts with adapting your diet and lifestyle, incorporating natural remedies, and being mindful of your overall health. Let's explore some key steps you can take to manage or even reverse the impact of diabetes, focusing on natural sources, diet, and lifestyle changes. 1. Cut back on high glycemic foods. To effectively manage diabetes, it's vital to cut back on foods that have a high glycemic index. These include items like white rice, regular pasta, and sugary cereals, which can cause rapid increases in blood sugar. Opt instead for low glycemic alternatives such as brown rice, whole grain pasta, and oats. Vegetables like broccoli, carrots, and leafy greens are also excellent choices. For snacks, choose options like apples, berries, or Greek yogurt, which have lower glycemic effects. Reducing high glycemic foods in your diet can significantly help in stabilizing blood sugar levels. 2. Incorporate healthy fats, nuts and seeds, and omega-3 fatty acids. Enhancing your diet with healthy fats, nuts, seeds, and omega-3 fatty acids has numerous benefits for diabetes management. For instance, walnuts, pecans, and pumpkin seeds are not only rich in healthy fats but also provide essential minerals and fiber, aiding in blood sugar control. Olive oil and avocados, full of monounsaturated fats, can improve insulin sensitivity. Omega-3s found in fatty fish like salmon, trout, but also seaweed reduce inflammation and support heart health. These dietary changes can help in the efficient regulation of blood sugar levels, improve heart health, and reduce the risk of diabetes-related complications. 3. Use anti-inflammatory spices and natural supplements. Utilizing anti-inflammatory spices and natural supplements is a beneficial approach in diabetes management. Spices like turmeric, cinnamon, and ginger have natural anti-inflammatory properties and can aid in blood sugar regulation. Turmeric contains curcumin, which may improve insulin function, while cinnamon can help lower blood sugar levels. Additionally, supplements like magnesium and alpha-lipoic acid have been shown to enhance insulin sensitivity and glucose metabolism. Incorporating these spices and supplements into your diet can support overall diabetes management, reducing inflammation and aiding in blood sugar control. 4. Add probiotic foods. Including probiotic-rich foods in your diet can have positive effects on diabetes management. Probiotics, found in foods like yogurt, kefir, sauerkraut, and kimchi, help improve gut health, which is linked to better blood sugar control and insulin sensitivity. A healthy gut microbiome can also aid in reducing inflammation and enhancing overall metabolic health. Regular consumption of these foods can support your body's natural ability to manage blood sugar levels more effectively. 5. Regular physical activity. Regular physical activity is a cornerstone in managing diabetes. Engaging in exercises like brisk walking, swimming, or cycling for at least 30 minutes most days significantly improves insulin sensitivity and glucose metabolism. Regular exercise helps in maintaining a healthy weight, reducing blood sugar levels, and improving cardiovascular health. It's not just about the type of exercise, but consistency matters. Even simple daily activities like taking the stairs or short walking breaks can make a significant difference in managing diabetes effectively. 6. Stress management. Effective stress management is crucial in diabetes care. Stress can significantly impact blood sugar levels, making it harder to manage diabetes. Techniques such as mindfulness, meditation, deep breathing exercises, and yoga can be highly beneficial in reducing stress. Engaging in hobbies or activities that relax and rejuvenate you also plays a key role. Managing stress effectively not only helps in maintaining stable blood sugar levels but also improves overall well-being, making it an essential part of diabetes management. Thank you for joining us on this journey to understand the less obvious signs of diabetes and the steps you can take to manage it. Remember, the path to managing diabetes effectively lies in making informed lifestyle choices, staying vigilant about your health, and working closely with your healthcare provider. We hope this information empowers you to take proactive steps towards better health. For more insightful health content, please like, share, and subscribe. Together, we are winning health.